Like many people, I have watched hopelessly as dementia stole a loved one from me. These are not the words of a grieving family member looking back, but of a leading scientist looking forward, standing on the verge of a revolution in medicine. For decades, the fight against Alzheimer's disease has felt like a losing battle, a war of attrition where the enemy is a ghost in the minds of our loved ones, and our weapons have been tragically ineffective. Consider this staggering fact. Over 95% of all new treatments for dementia fail in clinical trials. Over $43 billion have been poured into research and development, a vast sum of money that has yielded heartbreakingly little progress. But what if the problem wasn't entirely with the drugs themselves? What if, buried in the data of those failed trials, there was a secret to success, a hidden pattern that only a new kind of intelligence could see? Today, we delve into a groundbreaking story from the University of Cambridge, where scientists have used artificial intelligence to look back in time, reanalyze a failed drug trial, and make a discovery that could change everything. In this episode, we will uncover how an AI model can predict the future of an Alzheimer's patient with 3 times the accuracy of human doctors. We'll reveal the stunning results it found, turning a failed drug into a potential breakthrough for a specific group of patients. And we'll ask the ultimate question: is this the key to finally accelerating the search for effective treatments and fighting back against this cruel disease? The world of pharmaceutical research is littered with dashed hopes, but the graveyard for Alzheimer's drugs is particularly vast and deep. Imagine the process: years of painstaking lab work, immense financial investment, and finally, a promising compound is ready for a clinical trial. Hundreds, sometimes thousands of volunteers, patients and their families place their hope in this trial. They go through rigorous testing, scans, and treatments, all for the chance to slow down this relentless disease. And then, the results come in. The data is analyzed, and the conclusion is no significant effect. The drug failed. The trial is over. Hope is extinguished, and the company writes off millions, if not billions, of dollars. This has been the story more than 95% of the time. It's a cycle of promise and despair that has stalled progress for a generation. But why has this cycle been so viciously unbreakable? The core of the problem lies in a fundamental misunderstanding we've had about the disease itself. For years, we've spoken of Alzheimer's as if it were a single, monolithic entity. But the reality is far more complex. It's a spectrum. The disease manifests differently in each person. The speed of its cruel march varies wildly. The underlying biological drivers can differ in subtle but crucial ways. Imagine trying to design a single key to open 1,000 different locks. That's what researchers have been attempting. They would gather hundreds of patients, all under the umbrella diagnosis of early Alzheimer's, and give them a single drug. But within that group was a hidden diversity, some whose condition was driven primarily by inflammation, others by vascular issues, and still others by a different cascade of toxic proteins. By lumping them all together, any positive effect on a small subgroup was drowned out by the lack of effect on the majority, leading to a statistically flat, failed result. The brutal truth is that our trials were failing not just because of the drugs, but because they were fundamentally blunt instruments trying to solve a problem that requires a scalpel. This is where Professor Zoe Cortzi and her team at the University of Cambridge's Department of Psychology enter the picture. They looked at the data from this failed trial not with human eyes alone, but through the lens of a powerful, custom-built artificial intelligence. They unleashed their AI model on the cold, hard data of this supposed failure, searching for a ghost in the machine, a whisper of a signal that everyone else had missed. So what is this seemingly miraculous AI? It's not the stuff of science fiction. It is the new frontier of medical analysis. The model developed by Professor Cortzi's team is essentially a predictive engine. It takes all the standard clinical data for a person in the early stages of cognitive decline, their memory test scores, the intricate details from their MRI brain scans, the biomarkers present in their blood, and it synthesizes this information in a way the human mind simply cannot. The result is a highly accurate prediction of that individual's future. The AI can determine whether, and crucially, how quickly, a person will progress from mild cognitive impairment to full-blown Alzheimer's disease. And its predictions are not just a little better than the current methods. The Cambridge researchers found their AI gives a prognosis that is 3 times more accurate than the standard assessments made by doctors. It can effectively sort patients onto different timelines. This capability is called patient stratification, and it is the key to this entire breakthrough. Imagine 100 people in a room, all with early symptoms. To a doctor, they may look very similar, but the AI can look at them and say, these 30 people here will likely progress very slowly over the next decade, but these 70 people, their disease will advance rapidly in the next 2 to 3 years. This is a paradigm shift. It's like having a crystal ball for one of the most unpredictable diseases known to medicine. Let's unpack this a little more, because it's not magic, it's a new form of logic. A human clinician, no matter how brilliant, processes data sequentially. They look at the MRI report, then the blood test results, then the cognitive scores. They use their experience to weigh these factors and make an educated guess. The Cambridge AI works differently. It ingests all of this data simultaneously, treating it as one enormous, interconnected web of information. It doesn't just see a lesion on a brain scan, it sees the lesion's precise texture and location, and correlates it in real time with 10 different biomarkers in the blood, and subtle hesitations in a memory test that a human might dismiss. It hunts for multidimensional patterns across thousands of data points, patterns that are simply invisible to the human brain. It's a digital detective that can see the faintest of fingerprints left by the disease years before it kicks down the door. This ability to see the whole picture, the entire tapestry of a patient's biology at once, is what gives it that threefold accuracy. The idea of an AI seeing what human experts missed, of finding order in the chaos of a complex disease, is just incredible. If you think this is a mind-blowing application of technology, take a moment to hit that like button to show your support for this kind of innovation. Armed with this powerful stratification tool, Professor Cortzi's team went back to the data of that failed clinical trial. They fed the patient data into their AI model, and it neatly separated the original trial participants into 2 distinct groups, the slow progressors and the fast progressors. Now, they could rerun the analysis, not on one big messy group, but on 2 refined, specific cohorts. And what they found was astonishing. First, they confirmed that the drug was, in a technical sense, working as designed in everyone. It was successfully clearing a toxic protein called beta amyloid from the brains of patients in both the slow and fast-progressing groups. This initial confirmation was itself a critical piece of the puzzle. For decades, the dominant theory in Alzheimer's research has been the amyloid hypothesis, the idea that these beta amyloid plaques are the primary cause of the disease, and that removing them should lead to a cure or at least significant improvement. The fact that this drug successfully cleared the plaques in everyone, yet didn't improve symptoms in everyone, was a profound finding. It suggested that the amyloid hypothesis wasn't wrong, but perhaps radically incomplete. It hinted that there is a crucial window of opportunity. Clearing the plaques might only be effective before a certain amount of irreversible downstream damage has occurred. It's like putting out a fire in a house. If you do it early, you save the structure. If you arrive after the foundations have crumbled, putting out the flames won't make the house stand up again. The fast-progressing patients, it seemed, were already past that critical tipping point. But here is the multi-billion-dollar discovery. Despite the protein being cleared in everyone, only one group actually showed an improvement in their symptoms. In the fast-progressing group, there was no change in their cognitive decline. But in the group of patients with early-stage, slow-progressing cognitive impairment, the drug had a massive effect. It slowed their cognitive decline by a staggering 46%. Let that sink in. A 46% reduction in the speed at which their minds were deteriorating. A drug that had been declared a failure, a write-off, was in fact a highly effective treatment for a specific type of patient. The drug wasn't the failure. the design of the trial was. It failed because it gave the medicine to a mixed group of people, including many who were too far along or whose disease was progressing too aggressively for it to make a difference. As Professor Cortzi explained, promising new drugs fail when given to people too late, when they have no chance of benefiting from them. With our AI model, we can finally identify patients precisely and match the right patients to the right drugs. This discovery has implications that ripple far beyond this one single reanalyzed trial. It provides a blueprint for a complete overhaul of how we search for new Alzheimer's medicines. Future clinical trials can now be designed with this AI-guided precision from the very beginning. Instead of recruiting a broad, heterogeneous group of patients, researchers can use the AI to select only those individuals who are most likely to benefit from the specific drug being tested. This means trials can be smaller, requiring fewer participants. They can be faster because the effect of the drug will be clearer and more pronounced in a well-defined group. And they can be significantly cheaper, reducing the enormous financial risk that stifles innovation. This transforms the entire economic and strategic landscape of dementia research. Pharmaceutical companies are, at the end of the day, businesses. They have shied away from the massive gamble of Alzheimer's research because the 95% failure rate represents an unacceptable financial risk. Billions can be spent with nothing to show for it. But now, AI offers a way to de-risk the entire process. A company can now, with much greater confidence, design a trial for a specific patient subgroup. This not only increases the chance of success, but could lure vital investment back into a field that has been starved of it. It creates a virtuous cycle. More precise trials lead to more successes, which encourages more investment, which funds the development of more diverse and targeted drugs for different patient subgroups. We could see a future with a whole portfolio of Alzheimer's drugs, each tailored to a different disease subtype, much like we have different chemotherapies for different types of cancer. This AI-driven approach doesn't just salvage one drug, it has the potential to salvage the entire field of dementia drug development. This isn't just an academic exercise. The real-world potential is so great that Health Innovation East England, which is the innovation arm of the National Health Service in the East of England, is now actively supporting Professor Cortzi to translate this AI-enabled approach into actual clinical care for future patients. This is about taking a brilliant idea from a university lab and putting it into the hands of doctors to ease the immense pressure on the NHS, and, most importantly, to help people. The scale of the dementia crisis cannot be overstated. It is the United Kingdom's leading cause of death. Globally, it's a major cause of mortality, with an annual economic cost of $1.3 trillion. That's a T. And the number of cases is expected to treble by the year 2050. This AI offers a tangible path forward, a way to make our research smarter, faster, and more effective. What this story from the University of Cambridge truly reveals is the dawn of precision medicine for dementia. For too long, we've treated Alzheimer's as a single, monolithic disease, when in reality, it's a deeply personal journey that varies immensely from one individual to another. AI gives us the tools to finally understand and account for those differences. It allows us to move away from a one-size-fits-all approach and towards a future where we can give the right drug to the right patient at the right time. These medicines may not be an outright cure, but by slowing cognitive decline, they offer the invaluable gifts of time, clarity, and quality of life. As Professor Cortzi powerfully stated, bringing this story full circle, we've got to accelerate the development of dementia medicines. Over £40 billion has already been spent over 30 years of research and development. We can't wait another 30 years. It is this combination of powerful technology and deep personal motivation that fuels the most meaningful breakthroughs. Stories of innovation like this give us genuine hope in the face of one of humanity's greatest challenges. To stay updated on more incredible developments that are shaping our future, make sure you subscribe to our channel and turn on all notifications. You will not want to miss what is coming next. Thanks to AI, we are no longer just fighting a defensive battle against dementia, we are finally starting to fight back. Intelligently and